All right, today we're going on a pretty incredible journey. We're not heading to some faraway place, but deep inside the human body, into the winding maze of the large intestine. Think of this as a medical detective story, where we get to see how doctors solve the mysteries happening inside all of us. So let's get right into it. So take a look at this. It's essentially a map of a very important, very complex territory, your large intestine. But what happens when something goes wrong in there? How do our medical detectives get a clear look at this hidden landscape? How do they, light it up to find the clues they need? Well, the answer comes from a really clever tool called the barium enema. This is the special technique that lets radiologists turn what would otherwise be a shadowy, unclear area into a detailed picture of what's really going on. So, what is it exactly? At its core, a barium enema is an X-ray of the large intestine. But here's the secret sauce, this contrast media. It's a chalky liquid with barium in it, and it coats the inside of your intestine. That coating is what makes everything show up bright white on the X-ray. The whole point isn't just to see the intestine, but to study every single curve and contour to find anything that looks out of place. Okay, so let's get into the why. Why would a doctor order this kind of investigation in the first place? Well, it's usually to get to the bottom of some specific symptoms, to find the cause, or to stick with our detective story, to unmask the culprit behind whatever problems the patient is having. Now, one of the most common things doctors are on the lookout for is something called a diverticulum. Put simply, it's a little pouch that can form in the wall of the intestine. They're actually really common, especially in adults over 40. And while they're often totally harmless, they can sometimes cause issues, so spotting them is important. And check this out. This shows you exactly how it works. On this X-ray, you can see these little pockets, the diverticula, are filled up with that bright white barium. It makes them just pop right out from the background, so a radiologist can spot them in a second. The evidence is literally right there in black and white. A more serious mystery doctors might be trying to solve is a neoplasm, which is a tumor. Finding these early is absolutely critical. And what's really fascinating from a diagnostic point of view is the unique apple core shape these tumors can create as they grow around the bowel. It's a dead giveaway for our medical detectives. And here it is. Look at the image on the right. See that part in the middle of the white line where it gets super narrow? That is the classic apple core sign. It looks just like a half-eaten apple because the barium can't squeeze through normally. It's an incredibly powerful visual clue. Sometimes the mystery isn't a growth, but more of a mechanical problem. The intestine can literally telescope in on itself. The condition is called intestisception. It happens most often in infants, and it creates a serious blockage that needs to be fixed, and fast. This slide gives you a perfect idea of what's going on. On the left, you've got the drawing of the telescoping. Then on the right, you see the X-ray. Notice how the flow of the barium just comes to a hard stop. It creates this kind of mushroom shape. That tells the radiologist exactly where the blockage is. Now, like any good investigation, you can't just rush in. You have to do some prep work. Getting the crime scene ready is absolutely essential because if you don't, you're pretty much guaranteed to miss some crucial evidence. And the number one rule of prep is this. The large intestine has to be completely empty. I mean, totally clean. Why? Because any leftover stuff could be mistaken for a real problem, like a polyp, or worse, it could hide the actual culprit. A clean bowel means the barium can coat everything evenly and reveal all the clues. So our medical detectives have a couple of different ways to approach this. There's a single contrast study where they only use barium, but for a really detailed look, they often use a double contrast study. This is pretty neat. It uses both the barium to coat the walls and air to gently expand the colon. That combination gives a much clearer picture of the intestinal lining, which is way better for spotting smaller clues like polyps. All right, so the scene is prepped, the tools are ready. Now it's time for the investigation itself. Let's walk through the step-by-step of how a barium enema is actually done. Here are the key pieces of the puzzle. On the left, you see the specialized enema tip. Sometimes it even has a little inflatable balloon to help it stay in place. And on the right, the patient is in what's called the Sims position, lying on their left side with the right leg bent over the left. This position helps relax the abdominal muscles and just makes inserting the tip easier and more comfortable. The medical team follows a really precise process here. It always starts with good communication, just explaining everything to the patient. They make sure the barium is mixed up, lubricate the tip, and then gently insert it as the patient breathes out. And that last step there, that's a really, really big deal. The bag is never more than 24 inches above the table. That's a critical safety measure. It's all about using gravity to control the pressure of the flow, making sure it's effective but also very safe. Okay, so the barium is in, the x-rays have been taken, now the investigation moves into its final stage, analyzing the evidence. These images are packed with information, and radiologists are trained to read them like a complex code. You can think of this as the detective's secret codebook. Different conditions leave their own unique visual signature. For example, a severe case of ulcerative colitis can create what looks like a cobblestone pattern on the intestine wall. We already saw how intussusception can look mushroom-shaped. Radiologists learn to recognize all these telltale patterns to crack the case and figure out what's really going on. You know, this quote really gets to the heart of it. Radiology is such a visual field. It's all about translating a complex disease into a simple, descriptive term that everyone can understand, like apple core or napkin ring. It's a great reminder of how we make sense of things by seeing patterns, even deep inside our own bodies. And of course, through this entire investigation, patient safety is priority number one. Always. That means checking the patient's chart for things like recent biopsies, which could weaken the colon wall. It means never, ever forcing the enema tip. It means keeping that bag height at 24 inches or less. And just being there to help the patient afterwards because, it can be a little disorienting. So we go from a shadowy internal map to a clear set of clues. The barium enema is just a fantastic example of how medical imaging makes the invisible visible. It lets doctors solve problems without ever making an incision. It really makes you wonder, doesn't it? By turning the inside of our bodies into a clear picture, what other medical mysteries are we going to solve next?